Okay. Violin free. Oh. This is cute. I think I'll take one. Remember, I was here. Yeah.
Sorry, we're having technical difficulties over at Shoreline then.
Okay.
Can you hear us over at Kent?
Oh, barely.
Can you hear us now?
Well, because I have to bend over. My apologies.
Don't bend over. Scared me.
It's almost Halloween. Should have come in costume.
Is that,
Well, this is easier. You guys don't have to see me. You just have to look at the slides and hear me. And I just have to make sure I can see. I have to read that. Wild, happy, wild, and free. I think I go by old ages and for sissies.
okay. Can you hear us now?
She said,
Okay. I think we're finished with the feedback. All right. Wendy, sorry to make you do this again.
That's all right. Good morning, everyone. We have a nice group here at Shoreline, and we're looking forward to hearing what Dr. Fisher has to say down at the Kent Library. Thank you, Dr. Fisher and Stephanie McGill, her Public Relations Officer. Thank you, everyone, for your patience during our technical difficulties, and let's go ahead and get started.
Want me to start? Well, good morning, and I really thank you for coming through the traffic and all the rain to come and hear the presentation. I know it wasn't a pleasant day to come out. I'm going to give basically an overview of Medicare, and I will talk about it for people who aren't on Medicare and what you have to think about, and also about the other enrollments. Right now, we're in the middle of open enrollment, and it goes from October 15th to December 7th each year. And this is a time when anybody in Medicare can make changes to what plan they're on or what they're doing, to add like a drug plan or anything like that. So we'll start out with this, and I'll try to keep it in as simple, understandable as possible, because sometimes people do get confused, even me. So first of all, I want you to know that Medicare is 50 years old. It was passed in 1965 and signed by President Johnson. And the reason why I'm letting you know this is because when it started out, there was only parts A and B, something for in the hospital and outside the hospital. And since that time, in the last 50 years, it's been estimated that it's been changed by law about over 700 times. So you have to really sort of like we have people to help you so we can keep up with what's going on so that we understand the changes that are made. Did this just cut out? Hello?
No, you're still good.
Okay. Yeah, now it's back. Okay. But first of all, people get Medicare and Medicaid mixed up. And I do tell them that I work for the Centers for Medicare and Medicaid, two different centers, two different laws governing those plans that insure. And the difference is Medicare is administered by the federal government. So when you go from state to state to state, it's basically the same. There may be some differences in some local coverage decisions about what medical services are covered. You maybe a durable medical equipment product or something like that if there's no national coverage thing. But basically the federal government has the data, everything's basically the same, and it is the law, which is different from other insurance that you have when you're working for your employer. The law does govern insurance companies, you know, so they can't rip you off and things like that, but it doesn't tell them what to cover. That's why people tell you to look and see what's in there. But it's a little bit different from Medicare. It is federally administered and it's followed by the law. If you look at Medicaid, Medicaid is administered jointly by the federal government and the state. And the law says what Medicaid will cover, but it doesn't have to cover occupational therapy, physical therapy, pharmacy, and there's just a few things like that. But there's big general categories. And when you go from state to state, because it's a state-run organization, you'll find out it's different. Medicaid right here is really 360 degrees from what's in Oregon. And it's just different. And then some states have been given waivers to try to do special things to see how they help clients. Medicare, again, is for people 65 or older, for people that are disabled, people that have end-stage renal disease, and there's an ALS. And so, but if you look at Medicaid, it's for the disabled. And in some states, like this one, it takes care of 52% of the children that are born. So it's a different program and people get them mixed up. You can't go and just say, okay, I'm going to call up CMS, Centers for Medicare, and get all the data on Medicaid in the 50 states. You'd have to go to each state because they do it. So that's a little bit different. And when you sign up for Medicare, besides the illnesses that I gave you, it's age. And if you want to sign up for Medicaid, it has to do with your financial needs. So they're going to look at your resources that you have and income. And that might vary a little bit from state to state also. I already went through this. Now, who's running what? It gets confusing. I see like there's a presentation here in a couple of weeks on Social Security, and it's true, it's all the federal government. But Social Security signed you up for Medicare. And this is telling you you need so many credits because you seem to be in Social Security. You have to earn so much to get your credits each year. But Social Security is not running Medicare. Medicare is being administered by the Centers for Medicare and Medicaid. But it's true, you go to them and they're the ones that are signing you up. And if you wanted to make changes sometime or add something because say you got sick and suppose you had renal disease or something like that, you may end up going to talk to the people at Social Security. But they're not the ones that are administering Medicaid. Sometimes you hear about the trust fund for Medicare. And the trust fund, how it's funded is through the Railroad Board Retirement Trust Fund, interest on the trust fund, and the premiums that are paid. And we'll talk about this on the next slide. So that was when I was talking about as Part A. And I should tell you, I'm going to go into details. There's 4 parts to Medicare, A, B, C, and D. So, and we'll talk about that. A is for basically in hospital, and B is for outpatient. But you see, I want to let you know when you hear people or in the newspaper saying, oh, the trust fund and the trust fund, how are we going to keep the money going with Medicare? And so this is how the Part B of the trust fund is funded. And it has to do with the general funds coming in, the premium for for B, and the payments that come in too. And you can see that you have to pay for Part B. So, for example, when you turn 65, we'll talk about this more, you'll get signed up for A and B. But B, you pay according to your income. And see, it says income related adjusted amount, IRMA. And so it starts out at the lowest, and it tells you what it is. If you make less than $85,000 a year, then you're going to pay this base, 104.90. And if you make more than that, it tells you what it adds on to it. What is you must know is that if you sign up, say you're going to start next month, say with your Medicare, say you've gone out and you signed up. The B, they're going to go back and they're going to say, what are they going to look at your income? And what they're going to do is look at what you turned in on your IRS form. Okay, so which tax did you just got finished filing is 2000 and this is 14, okay? Now, but those may have not all been in. They may not all be through. So what they base it on is what you made in 2013. So it'll always be 2 years behind. And so when you come up, if you were making more than $85,000 in 2013, then you're going to see on there $42 added up to 107, et cetera, et cetera, et cetera. So over time, this will change because your income's going to change, but you need to let people know. And plus, they'll get the Social Security thing. But just to make sure. The other thing I tell people is anything that you're getting on information from Social Security or getting from Medicare or anything, save it. Save all your paperwork, have a folder, put it in. Okay, so let's look at basic parts of Medicare. A, B, C, and D. A and B are what we call original Medicare. That's when they signed it into law. Part A is hospital insurance. Part B is medical insurance. However, if you look at Part A, it also now pays for not only going in the hospital, but skilled nursing, home health, and hospice care. And Part B covers services for the doctor, other outpatient care. It covers some preventative services. There are like mammograms for women, and there's no copay or co-insurance with that. And it also covers flu shots, pneumonia shots, and hepatitis shots. I think it's hepatitis C. And then the rest of any drugs or medication, if you look up there, is Part D, where you have the drug coverage. So, and then Part C is like, say you wanted to get something that was like a health maintenance organization, an HMO, like group health. But there are more health maintenance organizations and different types, and I'll show you that. But in order to have Part C, you've got to be signed up for Part A and B. So here, when you look at this, you don't have Medicare. So you go and you need hospital coverage and you need medical insurance. Then you sit down and you say, okay, I have hospital insurance, I have medical insurance. Part A is free for most people. Part B, we just talked about, we're going to have to pay. So it's going to have some co-pays or co-insurance. A copay is something that's a set dollar amount. Many of you go into the doctor's office and you may, if you had insurance from your employer, had to pay a $25 copay. Co-insurance is always a percentage of what is allowed by the plan. Different plans, pay for differently. That's why we want to see what it is. So it's a percentage of that. That's what we mean by co-insurance. And it's confusing. I don't know why they came up with that title, but it's just a percentage of what they're saying, and they'll tell you what the percentage is. So here you are, you have original Medicare Part A and B, and then you can add a prescription drug coverage. And you have to stop and think about, you know, what drugs you're on. When you look up at certain plans for Part D, you need to look, okay, I'm on this medication, and look at what there's formulary, and they'll tell you what drugs they are covering. And they have to have drugs in all of the major categories, but it may not be the drug that you like, and in some things aren't interchangeable. But it's like everybody knows about Nexium, the little purple pill, the proton pump inhibitor. Well, all the drugs that are in that category, whether it's Prevacid, I can't even think of all of them now, Prilosec, they all work the same way, you know, in that drug, but that doesn't work in all drug categories. There might be some differences. So if you want to stay on a certain drug in a category, you need to look at the formulary to make sure. Now, you may decide, well, I want to go with the original Medicare, and I can go to any doctor that I want that has signed up or takes assignment with Medicare, or do I want to go to an Advantage plan? And the thing with the Advantage plan is most of them have a prescription drug coverage. So you don't have to get an extra plan. And you can look down and see what drugs they cover. And maybe, you know, they might cover dental, they might cover vision. You have to look, because all plans don't cover the same thing. And they're not required with A and B to cover dental and vision. So here we are, Part A of the hospital insurance: inpatient hospital services, skilled nursing facilities, home health benefits, hospice care. Now, I have up here what you're going to pay, what the deductible is for Part B. And I have it for 2015 because it's not out for 2016 yet. There's been a delay because of the budget things in Washington. Okay, so we don't have that. All right, so yearly deductible for this year was $147. So that means you're going to have to spend, this is outpatient, $147 from whatever you go in for a service. So you're going to pay the first $147 before Medicare kicks in. You have co-insurance. So let's say you go to the doctor and you see the doctor, you get tests and all this, and this doctor, you get a bill and you've met your $147 in deductible, and the bill comes out, I don't know, let's say it's easier to do with $200 or something. That would be really good. And you have 20% of that you're going to pay in co-insurance. And you're not going to pay anything for most preventative services. And you're going to have to pay for mental health and co-payments for outpatient services. They do a lot. So you've got this 20% that you have to pay. If you're in a managed care program, in one of the Medicare plans, it might be different. So you need to look at this and decide, okay, do I have a lot of problems? Do I have to be seen outpatient? Like, for example, do I make kidney stones all the time? And I'm going in and I have to have them zapped with lithotripsy or something. I'm getting some outpatient procedures. You need to look at that, and it's important to know what it's going to cost you, and I'll talk about it in a minute. Okay, so Part B, supplemental medical insurance or Medigap. And so what it'll do is it will pick up the costs, like some of the co-insurance is the co-payment for these services that are listed here. And I'll give you, and as we go on, I will also give you a chart and let you see what it looks like. But here we're talking about this supplemental insurance will pick up durable medical equipment, wheelchair, some of the payments with the difference with home health services and ambulance services. Okay, Part C, the Medicare Advantage plan. This plan is run by private insurance, but it's overlooked by Medicare. And what it means is that Medicare looks at it, they have a contract, they have to cover certain things, and so what you will see is Medicare will be overlooking the contract to make sure they're covering what they're supposed to see. It provides all the things that are in A and B. And like I said, it might have some additional benefits, and you must be in A and B to join. Now, the Medicare Modernization Act in 2006 put in for the drug program, or Part D. And if you look at this, I told you, for one thing, you really need to look at the formulary and to make sure that the drugs that you're on are being covered. When you look there, the thing is that you must also pay attention to the different types of plans and where they are. The other thing is that, for example, when we talk about Part D, you will find that there are different Medicare Advantage plans, and they may have different, formularies. There is on Medicare.gov a place for you to look at different plans, and so that you can see and compare. So what you want to do is compare the plans, then you want to choose a plan, and then you can either enroll at Medicare.gov or enroll at the plan's website, or call the plan. And if it's open enrollment now, who knows, you probably if you're on Medicare, you may be getting lots of literature telling you about different plans and stuff like that. You're going to have to complete the paperwork, pay the premium. You're going to have to pay the premium, the deductibles, the co-payments. You need to look at that because it'll vary depending on what med you're on. And if you're in a low income, there is a resource thing, and it's called Extra Help, and you can see that also at Medicare.gov, and it will tell you whether you are eligible or not to get extra help with paying for the Part D plan. I'm going to stop a minute. Is there a question? Nobody looks confused here, but I could be deceiving myself.
Do you pay Social Security or Medicare for the private policies, or is that a separate?
Oh, you're going to pay Medicare Part A and B, it comes out of your Social Security. And then for the premium for the plan, the Medicare Advantage plan, that goes to the plan.
Shoreline has a question.
Yes.
Okay, we're waiting for Shoreline. Shoreline, chat me your question. If you're watching online, we are taking one moment to wait for Shoreline to ask a question.
Well, we can, save it and come back to it.
Yes.
Okay.
Oh, here it is.
All right.
Is there a penalty if you switch to Advantage plan and don't have Part D?
I'm going to talk about that.
Okay,
Okay.
great.
Okay. Now let's talk about entitlement provisions. I wanted you to get up here and see the definition, what it means if you're about eligibility. And the person must meet certain criteria for enrollment. This allows the person to get an entitlement to Medicare, and then the entitlement is what the person gets that's covered in the plan that they sign up for. So for Part A, it's an insurance premium. Like I said, it's usually free. You paid your FICA when you were working, and so you had to have at least 10 years or 40 credits. And or there's if you were working for the Railroad Retirement Board, then you're eligible for Part A of Medicaid, Medicare. If your spouse has not worked, they can be deemed in on your 40 credits. Also, if you're divorced and you haven't remarried, they're going to take who makes the highest sum and put your Social Security benefit on that. So, but it doesn't, I'm not trying to say it's the same thing for here. For entitlement for provisions B, we have insured individuals. So I had listed before that you were entitled to Part B, and there is always a premium to pay. And what's listed down there is the state Medicare savings program. So if you're not paying for Part B, somebody is. And for people that really are low income, I think one of the sounds like a single individual, we're talking about making less than $2,000 a month. I can't remember but when you look down there, and depending on what your resources are and your incomes that come in, some people get the Medicare savings program, and that pays the benefits for Part B. So let's talk about enrollment periods. Anyone who meets the eligibility requirements can sign up. There are no separate enrollment periods for Part A. It's free, but they are tied to your retirement and your disability cash benefits. Right now, we're in open enrollment. That's October 15th to December 7th. So you can get in there, you can join or switch a Medicare prescription drug plan. You can join or switch a Medicare Advantage plan. You have time to review what's going on so you can choose what you need. And the things will change on January 1st. So these are the things to consider. Are your drugs covered? Are the services that you need covered? Do you have or are you eligible for health or drug coverage from someplace else? What are the costs, the deductibles, all the things that I talked about? And what is the outer limit for medical care that you're going to have to pay? Is your doctor in the plan or your healthcare provider? Is the hospital in the plan? What drugs are covered? And you can also get quality ratings on the plans at Medicare.gov. So you may want to go and look at that. And where you have to go, how far do you have to travel? And if you have to travel, if you're traveling a lot, say during the year, you need to look at what you're getting, because we'll talk about it later. Some of the plans you can't belong to unless you're in their area. And the other one is if you're going overseas, then you need, and you travel a lot most of the year, you may need a Medigap or a supplemental plan to pay for health care overseas. So by law, there are 3 enrollment periods: the initial enrollment period, the general enrollment period, and special enrollment periods. Open enrollment, which we have now, is I'm not counting in there because it's not the ones that's so by law. So timing is everything, because you want to avoid any snags or any penalties. So the effective date of your Medicare coverage is tied to the month that you turn 25, and we'll talk about that. And then we're going to talk about the difference in the enrollment period and what happens if you miss your enrollment period. So, this is what I was talking about. This was out of order. Remember, I was saying that you could get help if you need it with your Medicare savings program, and it tells you what the incomes are there and what premiums they can help pay for. Okay, so initial enrollment period. So you're currently entitled to Social Security benefits. It's 3 months prior to when you turn 65, so you should get an enrollment package in the mail. The package will contain the Medicare card, CMS Form 60, 1966, Medicare and SNS supplements, and a return envelope. You look at the card. If you want Part B, you just keep everything. If you decide you don't want Part B, you put an X in the refusal box, sign the form, and return the entire form. And we'll talk about why or why not you may not want Part B. So here's the enrollment period. It's 7-month period. So what month is your birthday when you turn 65? August. So he has the month of August, 3 months before August. Okay, so we go July, June, May. May, June, July. He has August and 3 months after, September, October, November. This is when you need to make sure you're signed up in the initial enrollment period. And if the thing is that if you're disabled, it talks about the disability down there, but we're talking about the straight thing. So you need to know those months. Okay, so in the initial enrollment period, if you look, I could fill in the months, what I say, May, June, and July, where it says MOE, that would be the month that of his entitlement when he turned 65, which is August, and then September, October, and November. So it's saying that in the month of his eligibility, the E in the middle, there's a C. So the first month of coverage if he signs up, the month he enrolls. If he enrolls the next month, he gets it the same month he signs up. And it shows you out, but as you go out further, there's a delay. Now, you want to make sure if you're retiring, and that's when you're signing up for Medicare, you want to make sure you sign up because you could be without insurance. And so the thing is, the sooner the better. And then you won't forget about it, and we'll talk about if you forget about it, the penalties. So let me give you a couple examples. Sylvia will turn 65 October the 20th, 2015. What is her initial enrollment period? 7-month period. If Sylvia signs up for Medicare Part B for three months before her birth month, when will her coverage start? If she signs up when she attains 65, when will it start? And if she signs up in the last month, when will it start? So here's the answers to their questions. And her enrollment period is from July to January of 2016. If she signs up 3 months before, her coverage will start the month of her birthday, which was October. If she signs up for Part B, when she attains 65, it'll start the next month. If she signs up in the last month, it won't start till April. And I think I can go back and show you the slide that puts that out. Okay. Okay, and it says, what happens if Sylvia enrolls in a Medicare Part B plan on February 2016? Now, remember, her initial enrollment period ended in January. So she's out of the initial enrollment period. Her problem is now, and she didn't sign up for B, she's no longer covered. They're set under her employer's group coverage. She's outside of that. So she can sign up in the next general enrollment period, which is January, February, March. But the thing about this is she may get a penalty. And if she gets a penalty, it's not a one-time penalty. As my friend said, read my lips, or ever. Because I had a friend that didn't sign up when I told her, and she let it go and let it go. So this penalty is on there forever. So what is I told you the general enrollment period was January, February, March of each year. But look, when the coverage doesn't start until July of the same year. So she's still without insurance on Part B for outpatient, okay? So it says that you can decline it, and we'll go over what, that it can be terminated. This may be why you're in here. It was terminated because you didn't pay the premium. Beneficiaries withdrew from the Medicare program, and individuals who enrolled during may be charged a higher premium, and I had said that. So here for Part B is the surcharge. 10% applied to Part B premiums for each full 12 months in which an individual could have enrolled but did not. And you weren't covered under your employee group plan. And they talked about this as being credible insurance. So suppose you work for a company and you retire and they have an insurance plan, you know, for you're not for your company, and it meets the requirements of Medicare. Or you may be eligible for Medicare and you're going to continue to work, but you still need to go down and sign up for Medicaid. Well, you don't, they sent you the thing. You can have Medicare Part A, it's free, but you can elect not to have B if your employee group plan is covering everything that Medicare would cover. Because remember, you pay for Part B. But you got to remember, when you finally don't have that plan, we'll talk about that. We'll talk about special enrollment to get on it. But you have to think about carefully about what you will need and make sure you sign up so you don't get a penalty. Special enrollment. It's those who delay enrollment because of coverage, say, under an employee group plan based on current employment. So you're working, you're over 65, you have Part A, you have your group coverage, and your group coverage is covering outpatient, regular things like insurance plans do. It's covering your drug. And now you're thinking about, oh, I'm tired, I'm working, I'm going to really retire. So if you're really going to retire, you got to get coverage either before the employment ends or the coverage ends, whichever comes first, on Part B. That's your special enrollment. You got 8 months after the coverage, the first full month ends, or your job ends, whichever comes first. You've got this period. So you need to know in order to avoid a penalty. So here it is putting out here about the 8 months, how many months you have from when you're eligible. They have the eligible month up in red, and it looks out for the 8 months, and it's telling you when your coverage is when you sign up. Now, I don't expect you to memorize this, and we'll get to the end to tell you who can help you with all this. But I'm just trying to tell you what the important things are. If nothing else, you got to know when you should sign up initially. If you're not taking B, then you need to know there is a specific time that you have to sign up to get a penalty. And these things are to remind you, if nothing else, to go to Medicare.gov and look it up, and that there's something going on there so you don't get a penalty. I don't expect you to memorize it, but I expect you to know, hey, I'm thinking about retirement. I better check into what kind of coverage I have so I don't get one of those forever penalties. So that's the idea with this. And to tell you, the sooner with all of them, the better, because some of them there's a delay, even in the initial enrollment period, of you being covered. And I can tell you, I can think about all the things that can go wrong with you when you're over 65. And I just remember my son coming out of college, and where I worked only covered him for so many months. And there was 1 month he was not covered for insurance, and he was nervous as he could be because he had learned the hard way. He cut his finger, and his father wasn't in town. I would have had his father sew it up. He's a physician. And so I had to go into the emergency room, and he got 3 stitches in his finger. And this is 2004. So that's 11 years ago. So things cost more, right? So that little trip to the emergency room cost $875. He saw the bill. It's not what I had to pay, but he saw the bill. So he was really nervous that he could be in a car accident or something, get hit crossing the street. I mean, he was really nervous about that, and he understands insurance. So what I'm saying here is, I want you to understand, you need to know initial enrollment and period. You need to know if you don't take B when you have to do your special enrollment, to look at it And you got to make sure you know that, or you will be paying a penalty. Example, Tara has been working for 40 years at a hospital. She's been covered under the employee group health plan. She's 70 years of age, and she wants to retire. Well, she wanted to retire October 16, 2015. Her group plan will end the last day of her employment. She wants Medicare to start the first of the month. And what month of her is the month of her special enrollment should she enroll in order to get covered in October? Think about that. Second case, Dave has been working for 45 years at Boeing. He's covered under their group health plan. He's 75 years of age. He wants to retire on the 16th of October, just like she did. His coverage will end in December. So they're giving you the end of the year. In what month does he have to enroll in B and have a start date of 1/1/16? So with Tara, she can enroll anytime in October for her to start October the 1st, Part B. October is her half month of employment, and her first full month will be in November. Dave needs to enroll in Medicare anytime in December for January 2016 start date, because the first full month of his SEP is November, so he's got time. But the idea is you need to know about this and call up, because you're not going to be able, maybe somebody here has a super duper memory, and I'll give you the things, but where to call up to get help about this. But to understand this, it's important to know what these enrollment periods are. So, and it says here, if you have a special enrollment period, because remember, it's depending on when you're working and when you lose your insurance, and it overlaps with the general enrollment period, you can choose what you want to enroll under. But if it's the initial enrollment period, that takes precedence over everything. So, Brian will turn 65 November 2nd. What is his initial enrollment period? 3 months before the month of his birth, the month of his birth, 3 months after. So he wants to retire December 31st and have Medicare Part B coverage start on January 1st. So if we use the chart, he signs up for Part B on December 2015, when will his coverage start? So here is his initial enrollment period. It's from August to February. He wants to retire on the 31st of December, so he gets his bonus at work, And he wants coverage to start for B on the 1st of January. So using the chart for Part B, when will his Part B coverage starts? If he waits and signs up in December, it won't start until February. So he needs to sign up sooner if he wants to make it. Okay. And again, that's the initial enrollment period, to give you an idea. So how many months do you have for the initial enrollment?
7.
Huh?
7.
7. 3 months before the month of your birthday, 3 months after. Okay? And you need to think about what you're signing up for, what's being covered. Okay, so here we go. Medicare delivery systems. We have original traditional Medicare, that was Parts A and B, and then we have Medicare Advantage plans, which cover both of them. We also have Medigap plans. These are the supplemental insurance plans. And these are designed, remember I told you, to supplement the gaps in the plans. So if you look at the Medicare Medigap plans, what it's talking about is, if you look, they're A, B, C, D, it goes all the way across. They're the same in all but 3 states. And it tells you what they're doing is they're picking up your copayment. On some of them, it's picking up the cost of blood. It's picking up some co-insurance. It's picking up part of your deductible, and you really have to have that out to look at it. And you can see that at Medicare.gov. And the idea is, the other thing is, I told you that we had help for you. And so we have state health insurance assistant programs, and they will help you with all of these plans: Medigap, Medicare, prescription drug plans, other health insurance plans that you have a question about. They'll also, the SHIBs or the SHIBA, you know, we have to talk in acronyms at the government. They can also help you with payment denials. They'll tell you about any appeals, how to go about it, complaints about care, treatment. They're there for you. And here is their number. I knew he was waiting for that. And so this is how you can get help. And the reason why you're saying, why give me all this information if I can get help? Well, you want to call at the right time, because what do you want to avoid? Oh, God, they heard something. Okay. Okay. So, for Medicare, 1-800-Medicare, English, Spanish, that's touch tone or dial, it's voice activated, it's available 24/7. And here it tells you what you call this line for too. And if you have a computer, then the idea is, you know, you can put on favorites. I would put down the Medicare.gov site. Okay. Now, questions? Yes, ma'am.
I'm just not sure what the difference is between Medigap and Medicare Advantage plan.
Okay. For the Medigap, if you have Medicare is not covering everything. You need to stay up late at night and listen to those commercials. Medicare does not cover everything. And they're trying to sell Medigap programs or supplemental things at night. And so if you look back here and you're going to go, I didn't get into all the costs, but there is a cost when you go into the hospital, okay? Because this was just an overview, okay? So what they're saying is that you have a certain amount you're going to pay for the period that you're in the hospital, okay? And what this Medigap will do, if you took Plan A, it will pick up that co-insurance for the hospital. If you look down for Part B, it'll pick up any co-insurance or co-payment that you have for Part B. So, and if you look down here, it's going to pay for the 100% of whatever it costs for having first 3 pints of blood, and it is going to pick up a hospital co-insurance. So what you're paying is, Medicare is paying Part 80% when you know, and you're going to pay 20%. So the thing is, that plan would pick up that. The question is, are you a person that has to frequently go in to see your physician? Are you having outpatient procedures? There are some people, excuse me, that they know quarterly they've got to have some kind of procedure, okay? And they're going to see a doctor. And then you're looking at this and you're adding up all these costs. And then you look across here, and where am I spending a lot of money that I can, I want to get into a Medigap program. And if I want to get into a Medigap program, what do I want to cover? Do I want to make sure it's covered at 100% for the benefits for Part A and B? Or do I'm more worried about A and less worried about B? So the question is to go down here and look, like there's plans that only cover 75% of whatever your copayment or co-insurance would be. So am I worried about A? Am I worried about B? Do I want to pick it up? And then when you go and you want to sign up for a Medigap program, I need to look at, you can sign up for that, I believe, in general enrollment. Let me look at my notes. I was going to say is that if you sign up in the enrollment period that you're supposed to for Medigap, a company has to show you a policy. They can't look at pre-existing conditions. If you sign up anytime after that, they can put restrictions on the policy. So let me make sure I have I think it's general enrollment or in your originally, I know you can sign up in the initial enrollment period, but the other one I believe is general enrollment. So the thing is, say you want to make a decision, you're working, and you're going to look at what I need for insurance. So I'm going to have Medicare Part A. And so then I'm going to need Medicare, say, Part B. But then I need a drug plan. Okay. And do I just need a drug plan? Or am I going to, if I take the insurance that the company offers me as a retirement plan, will it cover the drug plan and also cover some of the expenses where you may not need a Medigap plan? Because Medicare will be your first line of payment. And then the second line of payment would either be your Medigap program, or it could be a plan that's offered from where you're working.
But why would I get a Medigap? I get the two plans, but I don't get why you would get a Medigap versus a Medicare Advantage. Which one would you, how would you choose in general?
Well, you have to look at the Medicare Advantage program and see if it has co-pays and co-insurance or what, and what is the cost. So if you think about it, if you say got a plan that's covering everything, it's going to cost more than one that doesn't have all the extra things on it. So it might be cheaper to pay for Part B and it might be cheaper to pay for Medigap plan, a drug plan, and B than the premium. You have to look at that. So to make sure and some people wouldn't get a Medigap plan because they say, oh, I'm not going into the hospital a lot, I'm healthy. I mean, you can believe it, there are some 65-year-olds that aren't on any medicines at all. However, you may want to sign up for your Part D plan to make sure that you'll get covered if you ever need a drug so you don't pay a penalty. But they may not, I don't go into the hospital, the 1 or 2 times I go in, you know, they're healthy like 25-year-olds. I got a friend like that. I hate her. But anyway, what I'm saying is, so it's not going to pay you. But for some people that have a lot of health problems and stuff, and you know, it may not be their fault, it's just that's the way it is, then they've got to sit down and figure out how to get covered. So it tells you what's included and what isn't. And the reason why we have this open enrollment, they may change. They may change their deductibles. Well, these are standard, but some of the supplemental things, you know, they have to cover, they're going to cover this. But when you start looking like at the drug plans and this, and your health changes, okay. For instance, I didn't think I would, and I have time, is that when you start looking at, the plans like Medicare Advantage, I think I said, you're going to have to look at where they covered and are you in their area.
If you don't come up in a zip code, then you aren't covered even if you're getting stuff in the mail.
Oh,
Can you
repeat her question so that Shoreline can hear her questions?
Oh, what? If you don't live in a zip code?
Like I put a zip code in and only a couple came up.
Mm-hmm.
I'm getting stuff in the mail from other providers that didn't come up. So I'm wondering, am I covered? Like they're sending me stuff, so they must think I'm
Covered.
right?
Yeah.
So it didn't come up in the little...
but you can always go to their website and see. And there is on Medicare.gov a health plan finder. Is that what you? Yeah, I would. Yeah,
But
But-
you came up with different ones and they're sending me in the mail.
yeah. So you double check.
Okay.
Okay.
So we have a question from Shoreline. If someone signed up for Medicare and Medigap in 2005 but never had Part D, what are the penalties, if any, of switching to an Advantage plan with drug coverage?
I'll have to go and find that one out.
Okay.
Tell they can see. Oh, do they have to go back? I'm going to the end. See my email address to send that to me.
Okay. Which slide is that on?
It's at the bottom. It says Nancy dot Fisher. Oh, it didn't show up there.
Oh, then. Okay.
I forgot.
There we go. Okay. Please email her directly.
And the other thing is that once you get Medicare, look at this book. And it says, here it says health and prescription drug plans in your area. So you've got to be in the area to get the prescription drug plan, and you may need time you may be switching, well, you can get because you're moving or stuff like that. So this becomes like, look in here, fold the pages down, use this is yours. They send you a new one every year, highlight it, whatever you need, so you know what's going on.
Nancy, we have another question. Can the PowerPoint and presentation slides be made available to people turning in via the webinar? Is that something you'll be able to share with us?
Can they have the
The
slide?
slides?
Oh,
Would you be okay if we shared those online somewhere?
sure.
Okay. Yes, we will get those and share them online.
Who's putting them up?
We'll put them on the King County site somewhere. We'll figure out a spot.
Okay. Nobody will change them.
No, we will not change them.
Okay. Don't laugh.
Are these your slides or do they belong to everybody do the same job across
Okay.
the country? Or?
There's a training program that we put on every year. And the idea is you're asking me questions, and some of them I would have to go back, and I have to go back and look up because there's not penalties on it. So the individuals, there are people that do this all the time. And so the question is, what they did is they took the information off of our slides. Usually it says CMS slides and this, and put it down so that you could see some white and understand. Okay, because the other ones, it's got filled up with information. They want to make sure it's, it's we give it for the SHIPs and the SHIBA training, and you just get drowned in all of it. And so the thing is, what I could do is send you, I have to see if I can send you the module, and it has the CMS thing on it.
No,
But it is the same.
my stepdaughter in Los Angeles
Mhm.
needs to see this presentation. I was just wondering, do they offer this around the country or?
In Los Angeles, that's Region 9, and the main office, the regional office is in San Francisco. And yes, there are people that go out and do this. And it is standard. That's why, usually we have to wait for cleared slides. And if you start getting into some things, they'll put the law down. And so you can't, So there's things that I didn't put in here, but I was trying to think, you need to understand there's A, B, C, and D. You need to understand that there's a Medigap program for paying the deductibles, and where to go to get the information so you could sit down and study it if you want. But yes, it's consistent. And that's a good question about that. Which sides I should let you put up? Okay, yes.
Do the premiums ever change for Medicare or for instance, Medigap or the Advantage plan?
Yes.
From year to year, do they change?
Do the premiums ever change for any of the plans? The answer is yes. That's why you have open enrollment. That's why I don't have the price of, what do you call it, Part B. Remember, everybody's going to Congress. Why are you going to raise the fee on Medicare premiums? And some people are godfathered in, whether, if you signed up for B and you've been taking it, and some people that delayed it. And so, yes. You had a question?
I'm here for my mom.
Mm-hmm. I could tell you weren't 65.
I'm looking for like insurance for them for next years, which my dad has some kind of insurance for this year's through group health, but it's not covered only with my dad, but my mom don't have it. So my understanding about Medicare is at least 10 years worth, or at least to have credit, like 40.
40 credits.
So that means my dad and my mom won't be eligible for that at all. So what else other resources or medical insurance that could help them cover for it?
Well, what I would do is, did you copy down the telephone number where I told you to call and get information? The SHIBA, and to call and talk to them so they can go over and get, I'm not going to ask you any personal information. They can get the personal information and direct you about how you can get help for Medicare or where you can go. Oh, the other thing I wanted to tell you is Medicare is not part of the marketplace. The exchanges that you hear about, the insurance exchanges, the state run and the federal, it's not part of that. It's illegal for people to try to sell you if you're on Medicare, one of their plans. You don't need it. So that is separate. And it's not part of that. Okay.
Another question, what are the chances the preventative shingles vaccine will be covered in the future under parts A and B?
I have no idea. To tell you the truth, it's covered under the drug thing, right? Because it's only the flu, pneumonia, and that. And so I have no idea.
You can get it at 60. You can get it before you go. You can get shingles at 60 shot.
Yeah.
You don't have to wait till you're 65.
Oh yeah, but she's asking, to move it to, and I have no idea. And those, you'd have to have a ground swelling of why you'd want to move it and blah, blah, blah. So, yes, ma'am.
I'm interested in Medicare, but I cannot understand the English very well. I can't hear by phone. Where is Medicare office? Is there
Medicare.
office?
Oh, the office.
Office.
Oh, okay. Well, the Medicare office is downtown, but we don't do that. You're thinking like if you go into an insurance plan or something like that.
Mhm.
And can somebody call one of the number for the SHIBA or the SHIP and get information for you? What do you speak? What language do you speak?
Japanese.
Okay. Because they do have other languages,
Mhm.
and they would be the ones to help you. It wouldn't be our office downtown. It would be to talk to them.
Okay.
Okay?
Thank you.
Dr. Fisher, if somebody wants to know what they're actually currently signed up for example, my parents, I know they have Medicare insurance, but I'm not exactly sure what parts.
Well, they
So
should have
if
A and B.
Okay.
Or B, they should have A and B. And if they're on a Medicare Advantage plan, they're paying for, they don't pay for A, but they've got B. And they've got everything covered under Medicare Advantage.
So if they were to go online to the Medicare.gov site and establish some sort of, I think you can establish an account or a profile where you can see your coverage. So will that be displayed?
I think that it would tell them in general what is covered and what it is. If you have A and B, original Medicare, it's fee for service. So essentially you go out and find a doctor, and the doctor, what they'll do is if there's certain things that are not covered, they would explain that too. And I would think that the reason why they do that is some things in coverage change. Some things that we used before, we know they don't really work as well as something else. Okay.
Sorry.
But they probably don't have dental if they have A and B. But usually it's like what you want to make sure is that you've got A, B, and you've got drug coverage. Okay.
If you have Medicare Advantage plan,
Mm-hmm.
do you have to pay for Part B too?
Yes.
Okay.
We have one more question coming in, but we're waiting. So we've got one more from here.
Okay.
And the same with Medigap too, you still have to, you always have to pay
That's what I was saying about looking at what it costs
Right.
and what it covers and what it's going to cost you out of pocket.
Right.
It's this is trying to give you a way, if you just have, you don't go, you go, maybe go to the doctor maybe once a year, twice a year or something, then maybe you don't mind paying the co-payment, okay, $25, okay. And if you go into the hospital, I believe it's $1,200 and some dollars at least. And if you say, I'm not going to have a lot of procedures, I can save up money for that, rather than looking at a premium that you're going to pay, say, even if it was $200 a month, you wouldn't need that if you don't go that often. Yeah, you never know. But I'm just saying, but you could sign up for a Medigap plan later on, but the other ones, the B and the D, may have a penalty on them. But you could sign up for the Medigap plan.
So always pay B.
Yeah.
You always have to pay B.
Yeah.
Is there any hope for the donut hole closing?
It is closing, but it slowly. I don't know if Congress is going to tackle that again.
Hi there, I turned 65 in March. So I turned 65 in March. So as a recap, I should be getting a package in December. Is that what I understood?
He's getting a package.
So I
3 months in his.
I turned 65 in March. Should I be getting a package in December to sign up for Medicare?
3 months, you turned 65, so 3 months before. So December, January, wait, let me see. January, yeah, that's right. December, January, February. Yes. Somewhere in those 3 months before.
I should be
Getting a package.
receiving a package. Okay. So I really want to sign up for Medicare in December. Is that correct?
You want to sign up for Medicare December, January, or February?
Well, 3 months before is
Well,
what.
it gives you time. It's not going to start if I put this back up here.
Doesn't start until the month of your birthday.
I understand. But if I wait till March to sign up, it's not going to start till.
Yes, so look at it will start the month of your eligibility is the month that you turn 65. It will start that month. And
Okay.
if you sign up the month after, it'll start that month. But it's the next month after and the next one where you get a little bit of a delay.
All right. And
Okay.
coverage costs for the supplemental plans don't start until I turn 65, right? If I sign up in December, I'm not going to start paying until I turn 65, correct?
I believe so, yes.
Okay. That's all I want. Thank you.
But you can also ask those plans to make sure.
Well, thank you for your time.
You're welcome.
Does anyone else have any
Okay,
questions?
so if you're getting veterans benefits, I know you don't have to get Part D, because then there's an agreement that that's covered. So if you change it later, but Part B, I've gotten different information as to whether or not.
It's not considered credible
Okay,
insurance.
so you do have to still pay Part B. Okay.
And I don't know why, but I saw that when I was going, yeah,
The vets are counted.
yeah.
I think we're good. Thank you very much, Shoreline.
How many people are in Shoreline?
Awesome.
Okay.
Good turnout.
Thank
Thanks,
you.
everyone.
So are you totally confused? Thank you for telling me that.
No, you're. I know that it's really important that.
Yeah, we need to
Thank
hear
you
about
so much, Dr. Fisher.